meeting will begin in 30 seconds. The meeting will begin in 10 seconds.
Good evening and welcome to the Pitt County Board of Health August meeting. I'd like to call the meeting to order. We have a special set of activities we're going to start off with tonight. The first thing is to administer oaths of office, both to the new Health Director, Dr. John Silvernail, and also to two new members of the Board of Health.
You're going to hold the Bible for me.
Okay. Can I stand on that?
You can. Right hand on the Bible. Raise your hand. Or is it the other way around? Repeat after me. I do solemnly swear
I do solemnly swear
that I will support and maintain the Constitution and laws of the United States
that I will support and maintain the Constitution and laws of the United States
and the Constitution and laws of North Carolina,
and the Constitution and laws of North Carolina,
not inconsistent therewith,
not inconsistent therewith,
and that I will faithfully discharge my duties of office
and that I will faithfully discharge the duties of my office
as the Pitt County Public Health Director
as the Pitt County Public Health Director
to the best of my skill and ability,
to the best of my skill and ability,
according to law, so help me God.
according to law, so help me God.
That's it.
All right, congratulations. Okay, the next will be Kelly Pack Smith, one of our new at-large members.
I do solemnly affirm
I do solemnly affirm
that I will support and maintain the Constitution and laws of the United States
that I will support
and maintain
and
the
maintain
Constitution
the Constitution and the laws
of the United
of the
States
United States
and the Constitution and laws of North Carolina,
and the Constitution and laws of North Carolina,
not inconsistent therewith,
not inconsistent therewith,
and that I will faithfully discharge my duties
and I will faithfully discharge my duties
of office as a member of the Pitt County Board of Health
of office of the Pitt County Board of Health
to the best of my skill and ability,
to the best of my skill and ability,
according to law, so help me God.
according to law, so help me God.
All right. And next, Dr. Scott McIntosh, who's accompanied by his wife, also Dr. McIntosh, for the, to succeed Dr. Aycock in the optometrist position.
I do solemnly swear
I do solemnly swear
that I will support and maintain the Constitution and laws of the United States
that I will support and maintain the laws and Constitution of the United States
and the Constitution and laws of North Carolina,
and the Constitution and laws of North Carolina,
not inconsistent therewith,
not inconsistent therewith,
and that I will faithfully discharge the duties
and that I will faithfully discharge the duties
of my office as a member of the Pitt County Board of Health
of my office as a member of the Pitt County Board of Health
to the best of my skill and ability,
to the best of my skill and ability,
according to law, so help me God.
according to law, so help me God.
Congratulations. We're very appreciative of the previous two members of the Board of Health, Porter Stokes, for his service. And we also have a special recognition tonight for Dr. Lady Aycock, the long-serving optometrist member of the board, and I have a presentation for you. What Dr. Aycock mentioned back in, we need a microphone.
So we can hear you, yes.
Dr. Aycock mentioned early 19 that she was going to be retiring. My comment was, no, she can't retire. But and clearly she has been an outstanding member of the board, and we're very appreciative of all the services that she's provided. I remind folks sometimes that being on the Board of Health is a voluntary job, so to speak, but it's one that provides great service to the citizens of Pitt County. So we have a plaque for her. Let me just set this aside here. Here we go. Yeah. And it reads, Outstanding Service Award presented to Dr. Lady Aycock, optometrist, in appreciation for 18 years of service and dedication to the Pitt County Board of Health, 2001 to 2019. So, congratulations. Most appreciated.
I will just tell you, it's been an honor and a pleasure. I have enjoyed it, and being able to serve the people of Pitt County has been an honor. I would like to say one thing to all the employees at the Pitt County Board of Health. Y'all are fabulous over 18 years. Y'all are what makes it really work. And so I'm very proud of y'all, and I appreciate all your hard work, and I'm sure the people of Pitt County appreciate it.
Very good. Congratulations again. Okay, are there any public comments tonight? Hearing none, we'll move on to the minutes of the previous meeting. They've been distributed earlier via email. Are there any corrections or additions to those minutes?
There's none. No.
Is there motion to approve?
So moved.
So second. Any further discussion? All in favor say aye. Aye. Any opposed? All right, the minutes are approved. Move on to the fiscal report. Marcia.
Everybody tonight. I am going to be talking about July of 2019, which is our first period of our new fiscal year. For the month of July, we had one amendment already. That was a deduction in our Healthy Communities program. It was a deduction of $4,500 roughly dollars. It brings our overall budget to $11,640. We are having an active August, but I'll talk to you next month about that. Year to date, we are at a deficit because we're 1 month in. But when you look at our timing items of the Medicaid cost study that we have not received yet, the state funding, county funding, we are at a surplus of $202,528 for the month of July. We did receive Vidant Foundation funding for our Nurse Family Partnership Program of $25,000 and our Diabetes Self-Management Education Program of $40,000 this month. Our Medicaid cost study from 2015, we received notice this week that we should be receiving that 10% that is withheld with every cost study. Our clinical services program will be receiving $72,347. This is a desk audit that they do every few years. We owe $3,834 for family planning, which nets out to be a surplus of $68,513. We currently have 16 vacancies, 10 are being advertised, and I'm happy to tell you that only 2 of those positions are nurses. We have 1 physician extender, which is in the negotiation stage. 4 of those 10 being advertised are in WIC, and 3 will be able to be advertised as of August the 16th of next week. So, are there any questions?
Questions for Martha?
Motion to approve.
I second.
Second. Any further discussion? All in favor say aye.
Aye.
Any opposed? So the fiscal report is approved. Thank you very much.
Thank
Do you have any additional news for us, or?
No, that was pretty good, I
Projections or-
thought, but next month we'll have more to discuss.
Okay, very good. Okay, let's see, under old business, I don't think we have anything under old business, do we? Okay. I'll move on to new business, the annual communicable disease report. Looks like we're gonna have a series of reports here, starting out with Lee Cutler.
Hello. So, good evening. I'm Lee Cutler. I'm the Communicable Disease Supervisor at the Pitt County Health Department. And tonight, my team and I are here to hopefully give you an exciting update on our progress for our programs and performance for the year of 2018. So just as a general note, as the health department, we are given the authority to perform our duties within the communicable disease program based on North Carolina General Statutes, Chapter 138, Article 6. And that gives us the obligation to report the communicable diseases. It gives us the authority to investigate communicable diseases and issue the control measures that might go along with those. And it also gives us the ability to exercise quarantine and isolation authority. Our main communicable disease program objectives are to control the transmission of communicable diseases within the appropriate prevention and treatment, to detect cases of communicable diseases in the community, and to also monitor the trends of communicable diseases. At the health department, our communicable disease services include several things. The main ones are the surveillance for reportable general and STD communicable diseases via the old school paper-based reporting or via NEDS, which is our North Carolina Electronic Disease Surveillance System within those environments, and then also to provide prompt investigation of the communicable disease cases, whether it be a probable case, a suspect case, or a confirmed case, and then any outbreaks that might occur. Other services include, again, implementation of the control measures that might go along with that specific disease, provision of post-exposure prophylaxis, and provision of the health education to the community to try to enhance the prevention and disease control efforts. Maintaining communication between the public health agencies, private providers, the hospitals, and the occupational infection control personnel, and also providing 24/7 communicable disease response and reporting information for healthcare providers. Next up is going to be Renee Williams, who is our STD program coordinator.
Good evening. I'm going to go ahead and report on the Pitt County STD program goals. They are to monitor the STD rates and trends in Pitt County, to ensure adequate treatment is given to all patients that are seen in Pitt County by private and public medical providers, and also timely reporting to the state CD branch using the North Carolina Electronic Disease Surveillance System. Thank you. Pitt County Public Health Department provides confidential STD exams, testing, treatment, counseling, and referral for treatments as indicated. This slide shows the STD case counts for the year 2018. You can see that chlamydia accounted for 69% of the reported STD cases for Pitt County, gonorrhea 22%, NGU 7%, and syphilis 2%. This slide shows the demographic distribution of the STD cases here for Pitt County. looking at trends, when you're talking about the chlamydia cases for the 2018 year, we are seeing a slight downward trend, which is good news. Also for gonorrhea, no matter how slight, there is still a downward trend, so we're very happy to see that. Now I'm going to go on to the HIV syphilis services. Pitt County Public Health Department provides syphilis and HIV counseling, follow-up and referral, investigation of disease control measure violations, syphilis and HIV partner notification services. This slide shows for our statistical information for new HIV cases for the years 2014 to 2018. 2017 was a bad year for Pitt County, but we have seen a decline with the 32 cases. As far as the AIDS cases, unfortunately, that has a little bit of a small gain there by from 21 cases in 2017 to 22 in 2018. Syphilis cases were trending a little upward here in Pitt County. In 2017, we had 39 cases, and for the 2018 year, we finished the year with 47. Jessica Hardy's going to come up now to review the CD program.
Good evening. I'm Jessica Hardy. I served as the CD coordinator for the year of 2018, but I'm now the Women's and Children's Health Nursing Supervisor. But I'm going to be reporting on the activity for the 2018. So the program activity, I'm going to go over 3 different groups of communicable diseases that we saw in 2018. The first group is the bloodborne diseases such as hepatitis B and C. The second group is the foodborne diseases such as salmonella. And the third group is the vector-borne diseases like Rocky Mountain spotted fever and Lyme's disease. So in 2018, we had 9 chronic cases of hepatitis B that were reported. We had 19 cases that were reported that were determined to not meet case definition according to the state guidance. And we had only 1 acute case that was reported. We also had an additional 34 cases that were reported that were previously reported in other years. And the only thing we have to do with those is just make sure that they're following control measures. In 2018 for hepatitis C, we had 28 patients that were reported that were in the end determined to be chronic cases and not acute cases. In this state, acute hepatitis C is the only thing that is reportable currently. But we did have 5 patients that were reported that were determined to be acute cases. The second group is the foodborne. We had 15 confirmed cases of Campylobacter in 2018 and 6 probable cases. We also had 11 confirmed cases of salmonella and 7 probable cases of salmonella. Shigella is another foodborne disease that we see, and we had 3 confirmed cases and 2 probable cases in 2018. Moving right into the vector-borne diseases, the new name for Rocky Mountain spotted fever is spotted fever rickettsiosis. I think I said that right. So we had 3 probable cases of that and 0 confirmed cases, but we did have 27 additional cases that were investigated and were determined to not meet case definition according to the state guidance. For Lyme disease, we had 3 probable cases and no confirmed cases, but we did have 7 cases that were investigated and determined to be did not meet case definition. And we had no ehrlichiosis cases, so that was good. So this just goes over some additional communicable diseases that we investigate here at the health department, such as Group A strep, Legionella, Vibrio, pertussis. We also investigate the flu deaths for both adult and pediatric patients. And we met 100% of our benchmarks according to our agreement addendum for communicable disease. And I'm going to turn it over to Lee Draper, who is our immunization program coordinator.
Thank you. Our immunization program goal is to eliminate vaccine-preventable diseases. We do this by ensuring people are age-appropriately immunized. managing outbreaks of vaccine-preventable diseases, and by providing health education to the community to improve immunization rates and protect via cocooning or herd immunity, which is protecting infants and other vulnerable people who can't get vaccinated. Pitt County Health Department provides immunizations at no cost to eligible children through a program called Vaccines for Children. We also provide shots for adults through pay up front, filing Medicaid, Medicare, MedCost, and United Healthcare. We provide post-exposure rabies shots. The North Carolina Immunization Registry is North Carolina's statewide registry in which all Pitt County pediatricians use and is the engine that runs the reports for the rates. Definition of the immunization compliance rate is the percentage of kids who have documentation of being up to date by 2 years old with the 19 recommended doses of shots. Our benchmark for the 2-year-old cohort group last year was to meet a 90% goal, and we exceeded it. Our county rate almost met the benchmark at 75%, and we met the Healthy People 2020 goal. Next up is Lee Cutler with tuberculosis.
So I've served as the tuberculosis coordinator for the past 2.5 years also. But hopefully next year, this time, somebody else will be giving the presentation since we've hired a new tuberculosis coordinator. But so for the program objectives for tuberculosis is to basically eliminate TB as a public health threat. And we're trying to reduce the number of new cases of tuberculosis and also control the spread of the infection into the general population. And we do this by providing TB surveillance and case and contact investigation, and also by providing direct observed therapy for the TB cases. We provide treatment of the contacts, and we also provide isolation and other control measures of TB for those that need it. For the year 2018, we had a total of 47 latent TB infection cases. We had a total of 3 new TB cases reported, and I followed a total of 4 TB cases. One of them was a carryover from the year 2017. They were receiving direct observed therapy, daily direct observed therapy for a year. And for the year 2018, 100% of our program benchmarks were met for TB. So in summary, for the communicable disease program, the factors that impact the effectiveness of our communicable disease control efforts are basically the ease of access to quality health care, the timeliness of the access to quality health care, increasing community awareness education regarding the existing and potential health threats, and community partner collaboration. You can see on this slide the communicable disease focus, the goals that we had. So most recently from 2017 to 2020, we've duplicated some of the same goals, mainly because we feel these goals are extremely important goals to try to achieve. Last year at this time, we were rolling out a new electronic medical record system. I think we'd only been on it for about 3.5 or 4 months at this time of the presentation, and we were experiencing a large nursing staffing shortage. Currently, however, we're doing well with the electronic medical record system, and I'm happy to say that we've hired several new public health nurses. So this time next year, hopefully, I look forward to being able to give you all another encouraging report for us. Thank you.
Very good. Does anybody have any questions from any of the presenters?
I've got one. The 24 months with the 19 vaccinations, that was 100% benchmark. That was for the elderly. What's the sample size on that? I mean, is that for every kid in Pitt County?
No, that's for the health department.
Okay.
That's our patients that we call ours.
Okay.
And that includes private pediatrician offices.
Thank you. That was going to be an incredible number. It still is, but I was really going to be impressed.
All right, does anybody have any other questions? Or that's a tremendous amount of data. We sure appreciate you updating us, and we'll look forward to future updates. I might just comment to the public that the trends seen in the syphilis and chlamydia and so forth are also in parallel with national trends. It doesn't excuse us for having some upward trends, but just to let you know, these are national, and so all communities are dealing with some of these same issues. There is some tie-in with some of the opioid problems that have gone on, so we hope to have some improvements when we see reports next year. Okay, is there any other new business prior to the health director's report? Amy, any additional business? Dr. Silvernail, this will be your first official health director's report.
Thank you, Dr. Ramsey. Amy hasn't stopped smiling since I was sworn in on July 1st. But first, I'd like to thank the ladies and gentlemen of the board for choosing me to be the new health director. I look forward to serving in this capacity and doing so for a long time to come. Been working hard to get settled in and acquainted with our programs and staff. It is all starting to gel. There's a lot of programs to cover and get squared away in my mind, but we're getting close. I've been trying to meet with our local and state partners to establish new ties and continue the ties that Dr. Morrow worked so hard to build over the years. Communicable disease report tonight, very good. Thank my staff for the hard work that they do. I spent a lot of time with these ladies already, working with them and to understand their processes and supporting their work. We did send out one informational message this past month about the brain-eating amoeba concerns that were brought to my attention. Fortunately, we did not have any cases here in Pitt County of that. We are in the process of taking on a grant to do some education. So this kind of spans communicable disease and education for pre-exposure prophylaxis in folks that are high risk for HIV infection. And that grant will go live in September. We'll start to do some education to providers to hopefully increase the prescribing of those medications. Clinical services, my staff alluded to, we hired 3 new public health nurses. We have an offer out to a physician extender. We are hoping that that candidate will accept the position, but we are not sure. They are still considering the position. In our nutrition and WIC, I'd be remiss if I did not mention that World Breastfeeding Day is coming, and we will have a celebration on August 20th from 10 to 11:30 for World Breastfeeding Day. Finance and administration, you saw how we're billing more and more of our insurances there. At this time, we do not have a professional biller coder person in the practice, and it's something that I would suggest to the board that we strongly consider as we move forward with this so that we can improve our financial recovery for the services that we render. I don't think that Marcia mentioned we did have to rebate to Virtual Health $6,974 as a contractual requirement to help with the enhancement of that program. And that is my report. Happy to take questions from you if you all have questions.
All right, questions for Dr. Silvernail?
Thank you.
Well, thank you, and we're glad you're here.
Glad to be here.
All right, is there any additional business tonight? Hearing none, we're very appreciative of the reports, all the reports for tonight, and appreciative to have new members and some new blood on the Board of Health. There is, I think there's an orientation for board members that we'll discuss with you at the next meeting. We haven't had to orient anybody for a while, so we're going to have to get back up to speed on that. So, and also thank Betsy and the staff for getting organizing everything for tonight's meeting. We're very appreciative of that. So, if there's no other business, is there a motion to adjourn?
So moved.
Is there a second?
Second.
Any further discussion? All in favor say aye.
Aye.
Any opposed? All right, meeting is adjourned. Thank you very much.